Welcome to an overview of Electronic Health Information Exchange in Pennsylvania. I'm Alix Goss, Executive Director of the Pennsylvania eHealth Partnership Authority, the independent state agency responsible for establishing and governing health information exchange in the Commonwealth. I'm joined today by Dave Grinberg, Deputy Director. Together, we'll discuss the reasons for Electronic Health Information Exchange and Pennsylvania's approach, progress, and resources. Electronically capturing health information and having the ability to effectively exchange health data is an essential ingredient to achieving the triple aim objectives. The triple aim seeks to enhance the patient care experience and achieving better outcomes, improve the health of our population, and achieve a better cost of care. For instance, having medical records available in an emergency can prevent problems related to allergies and help inform emergency room care team decisions. Or consider the ability to easily share lab results among treating clinicians to avoid unnecessary testing, including the impacts to the patient and expenses. So what's in it for me? The healthcare system can be complex and challenging. At one point or another, we'll all be consumers of healthcare services. During the medical care, you may also want some of the administrative headaches removed, to know that the data is where it is needed to be, when it is needed, by those you've selected to take care of you. By improving the connections of the healthcare system through technology to link providers delivering care together, we can achieve the triple aim: better quality care that's affordable. Most healthcare happens locally, and many providers are already using electronic health record technology. The Office of the National Coordinator and the Centers for Medicare and Medicaid Services oversee the Electronic Health Record Certification Program and have published statistics on health IT usage as of 2014. 94% of non-federal acute care hospitals use a certified electronic health record. 78% of office-based physicians use an EHR system. However, only 14% of office-based physicians electronically share patient information with other providers. This is particularly important for our senior population when you consider that the typical number of providers seen by a Medicare beneficiary is 7. A typical primary care doctor has to coordinate care with 229 other physicians working in 117 practices. A provider connecting their certified EHR to a regional health information organization, or HIO, can extend a provider's investment in technology to enable more effective care coordination. Regional HIOs support data exchange and integration services. Pennsylvania's certification program for HIOs is a service of the Pennsylvania eHealth Partnership Authority. When an HIO becomes certified, they have proven their ability to comply with legal, technical, and policy requirements, culminating in their connection to the PA Patient and Provider Network, or P3N. P3N supports cross-community data exchanges for patient care coordination and enhanced provider reporting of health data into state government agencies, such as the Department of Health and Medicaid within the Department of Human Services. The idea behind the design of the authority and its P3N services is to extend private and public sector investments in technology through a thin layer of services. The service technology does not store or hold clinical data. Rather, it helps with identity management and exchange of clinical documentation among authorized providers. This journey to a connected, more effective, and efficient healthcare system is not just a Pennsylvania journey. It's a national movement that has made progress since 2009 with the passage of HITECH, Health Information Technology and Economic Clinical Health Act, as a part of the ARRA stimulus bill. As we've discussed, Pennsylvania is working to connect our in-state providers. We're also developing plans for connecting to our neighboring states to support citizen movements.
The authority was legislatively established by Act 121 of 2012, though the authority continued work that went back to 2011, and there have been state-level efforts to establish electronic health information exchange in Pennsylvania back to 2008. It's important to know that the authority is an independent agency, a public-private partnership, meaning that our board consists mostly of private sector individuals appointed by the governor or legislature. The Secretaries of Health and of Human Services are represented on our board, and there are 2 ex officio non-voting directors elected by our stakeholders. The board has adopted a strategic plan that includes our vision, mission, and guiding principles, plus, of course, a detailed roadmap for authority activities through 2017. Our mission encapsulates the statutory underpinnings and stakeholder expectations of the authority's work to establish a statewide interoperable system for participating organizations to electronically move health information in a manner that ensures the secure and authorized exchange of health information to provide and improve patient care. The guiding principles are provide a yardstick against which we measure all our efforts. The full plan is available on the authority's website. So as the old adage goes, a picture is worth 1,000 words. The Pennsylvania Patient and Provider Network, or P3N, is the brand name, if you will, for the network the authority has created here in Pennsylvania. You'll see that along the bottom of the slide are all the entities that ultimately leverage HIE to provide improved patient care: hospitals, labs, payers, doctors' offices, and so forth. These users do not connect directly to the authority. Instead, they work with health information organizations, HIOs, or health information service providers, HISPs. HISPs provide secure point-to-point exchange services. You can think of it as secure email for healthcare. HIOs provide a broader range of HIE services, usually including the ability to query the network for all records pertaining to a particular patient. The authority provides certification programs for both HIOs and HISPs that incorporate legal and regulatory requirements, policy choices, and technical components. The goal of the certification program is to make sure that all players are capable of interoperable exchange, only have to sign one set of legal agreements, and can trust all the other members of the certified community. In fact, we call the certified entities trust communities, and those trust communities help to develop and keep the certification programs up to date. Currently, there are 6 certified HISPs and 4 certified HIOs, and there is statewide availability of services through these certified entities. But others are welcome and encouraged to come join. As always, more detailed information regarding the certification programs, to include all the policies and application documents, is available on the authority's website. The certified HIOs connect to a thin layer of services provided by the authority. This includes technical services to handle patient identification, so we can tell that the John Smith living at 123 Main Street is or isn't the same as the John Smith living at 123 Main Avenue. The authority maintains a state-level consent registry that allows patients who desire to opt out of P3N exchange. It also includes some tools to facilitate document exchange and a provider directory. It's worth noting that the P3N supports a variety of technical standards and connection methods to help meet the private sector organizations where they are. As noted by Alix, no clinical information is stored at the P3N level. This helps make the network more secure and less susceptible to hacking. Finally, the P3N technology layer includes the Public Health Gateway, or PHG, which provides a one-stop connection through which providers can submit information through their HIOs to a variety of registries within the Commonwealth government. Current production-ready capabilities of the PHG include the Department of Health's Electronic Lab Reporting Registry, Immunizations Registry, Cancer Registry, Syndromic Surveillance Registry, and the Department of Human Services Electronic Clinical Quality Measures Reporting Registry. We are working in cooperation with the Departments of Health and Human Services to expand PHG functionality in the future.
There are numerous benefits for a regional health information organization to connect to the P3N. HIO certification ensures that all the participating HIOs are operating on a level playing field, as Dave noted earlier. This is in regards to interoperability of systems, privacy, and security. To become a certified HIO, the organization must first agree to the multi-party legal agreement. Being a certified entity enables HIOs to be eligible for grant programs designed to offset provider interface costs. P3N services help ensure the patient identity is verified to support effective consent and clinical document exchange. Regional HIO connection to the P3N, as noted before, assists with consent management of data exchanges. In other words, a citizen has the ability to opt out of the data being shared across the P3N, as well as to opt back in should they change their mind. This is an additional right granted to citizens under Act 121 of 2012. Providers gain time efficiencies when their certified EHR and HIO connections enables reporting into state government. Each state has their rules that are more stringent than HIPAA. Efforts to establish interstate exchange agreements will extend the value of P3N in supporting more effective care for patients as they go to the beach, climb mountains, or travel to other cities for business, vacation, or medical care. To support our goals to protect data and advance our collaborative approach to best practices and problem solving, we have several avenues for working together. HIO and HISP trust communities are forums for our regional HIOs and direct secure messaging partners. Interested stakeholders, whether citizens or industry partners, are encouraged to participate in our stakeholder committees and to attend our board meetings. To ensure our alignment with the national health IT effort, we participate in national discussions to share Pennsylvania's experiences and to advance solutions to common issues experienced across the country.
Throughout our existence, the authority has sought to find ways to leverage federal and other funding to incentivize adoption and expansion of electronic health information exchange. Currently, there are a few grant opportunities that are being financed in part by the Centers for Medicare and Medicaid Services. One program provides HIOs with up to $70,000 to onboard each eligible hospital facility, and a second provides HIOs with funds to help them onboard ambulatory practices. We have nearly $10 million available to support these efforts now through the end of September 2016. Other programs expected to be announced very soon will provide HIOs with funding to onboard long-term and post-acute care facilities who are technically ready for full HIE participation, and with funds to build and deploy portals to permit some level of participation by long-term and post-acute care providers who may not have the necessary technology for full HIE participation. We're excited about these programs because, as some of you may know, LTPAC providers were largely left out of earlier federal government incentive programs for the adoption of health information technology. We hope that we will be able to continue such efforts in the future and even expand them to additional provider types. Once again, you can find more detailed information about the grant programs on our website, along with information about eligible hospitals and providers, and information for those providers to help them in selecting a certified HIO if they don't already have one picked out. And there's the information about the pending announcements. You'll find on our website also a resource to help providers select the HIO that's right for them. The authority has ongoing activities on many fronts, and most of them depend upon collaboration with stakeholders. Here are just a few of the topics we're currently working on with our stakeholder community. If you're interested, you can register as a stakeholder on our website. When you register, we'll send you our monthly stakeholder newsletter, as well as occasional hot topic emails. But more importantly, you'll learn about additional opportunities for stakeholder involvement as they come up, should you wish to more actively participate. As you can see here, we have a number of standing committees. Some of these are strictly by invitation. For example, the trust community committees are just for certified participants, but most of the others are open to anyone with an interest. Come register as a stakeholder, and we'll help you figure out how to get involved if you'd like to be. So at this point, we've mentioned the website a bunch of times. Here's the URL. The authority is committed to operating in as transparent a manner as possible, and we use the website as a primary tool to push information out about authority goings-on. I urge you to visit and peruse the various materials available, and of course, to register as a stakeholder.
We thank you for joining us for this December 2015 update on the authority and its services, including certification programs and a network called the Pennsylvania Patient and Provider Network. We encourage you, as Dave said, to check back, leverage our resources, and be in touch with us so we can help you get connected in improving the healthcare system in Pennsylvania and beyond.
And by all means, if you have any questions, please feel free to contact us by email at ra-paehealth@pa.gov. You'll notice also that in the slide deck that's posted to the website, there are some additional slides that offer a bit of additional information. Again, thank you.